Yes.
Yeah, start.
Recording started.
Dr. Deepa Raje.
I welcome all of you. So today is 5th September, Teachers' Day. So wish you all the teachers happy Teachers' Day. And today is the Love Spreading Day as well, International Love Spreading Day, plus 5th August, 5th September, Teachers' Day. So I request our President Sir to take the stage for further proceedings. President
Very
Sir.
good afternoon, each and everyone
Yes.
who are with us today, and very happy and proud to start
Yes.
our continuous webinar series. And today we're having a special webinar on the clinical experiences.
Right.
Now, it is a good time to start the webinar with the Shankanadam. Now I request our beloved patron Dr. B.D. Patel sir to make a Shankanadam. Sir, please. Thank you, sir. Thank you. Thank you very much. Yes.
Hegde sir, you can have your welcome note to everyone.
I am very happy to welcome you all for the today's webinar. First of all, a senior most teacher with us, Dr. B.D. Patel sir. Sir, this is a good occasion and moment to wish you all who are all here, all are your students. And I am very proud to say that happy Teachers' Day to you, sir, with all our pranams. Please accept, sir. This is our sincere request on behalf of KQHDA, all the members. We give our tributes to the teachers who are all teaching the learning for the both. Then I am happy to welcome KQHDA Chairman Dr. H.L. Swami and our past presidents, as well as our office bearers and many homeopathic doctors of KQHDA, as well as from other outsiders. And I am happy to welcome in person to the today's speakers, Dr. Shailaja Tejamurthy, Dr. Manish Chopra, and Dr. Chirant. And this is the occasion where KQHDA encourages and give an opportunity and sharing the experience and knowledge in the platform. And that is our initial and primary motto, to do such functions like seminars, webinars, or maybe the clinical camps, or organizing some other functions, all these things. That's why for the last 2-3 webinars, we are giving an opportunity to use the dais for the KQHDA Life members. And many more are in a queue, I know. And certainly everybody will be given an opportunity to share their experience and knowledge, and by the same time utilize this platform for enriching your knowledge, as well as what I can say, the focusing on your ability to learn as well as teach others also. And today is such a day that the Teachers' Day, and a good day where we remember the great stalwart teacher Radhakrishnan. And another very interesting thing, that one of our KQHDA Team 20 office member, Dr. Manisha Chopra's birthday, sir. And on behalf of KQHDA, we all like to wish you, Dr. Manisha, wish you happy
Thank
many
you
returns
so
of
much.
the day.
Very nice.
God bless
Manisha
you.
जी, क्या बात है? आप छुपे रुस्तम.
And
बताया
we
नहीं.
wish you all the best. Okay.
Thank you. Yeah.
And by the same time, now with us, a very senior most doctor is Dr. B.D. Patel, sir. I request him to give a message on this Teachers' Day. Sir, please.
Thank you, Dr. Hegde ji. Anyhow, let me once again wish Manisha Chopra everything what she wishes in life, she should get, except ahankar,
Yes,
which
sir,
is
surely.
what,
Thank you so much.
which is what the Jains have always kept it away of the door. Any Jain man you see, Jaini Muni, they just bend down, no ahankar. That is the best quality of a teacher. A teacher, the moment he thinks he is teaching someone, he lost his teaching capacity. Never ever think, and many times we see speakers say, the youngsters must learn, the students must learn, and you should learn. That itself is the quality which should not be there in a teacher. Another one quality in a teacher should be, a true teacher should be able to immediately come down to the level of the student who is not understanding. He should transfer his soul to the student's soul so that they both vibrate and the boy understands what the teacher is trying to tell. And a beautiful statement as we celebrate Sir Dr. Radhakrishna's birthday as Teachers' Day. He gave a wonderful statement when he was asked, sir, what is the difference between station master and school master? Everybody was surprised what this man is going to answer. And what a beautiful answer he gave. He says, station master minds the train and a school master trains the mind. What a beautiful answer. Now, see, as you know, many times I quote from Vedanta, Vedas and Upanishads. There cannot be anything better said than the Vedanta, than the Vedas and Upanishads. According to Vedas, it's clearly said that you cannot teach anyone which he doesn't know, what he doesn't know. That means whatever you are learning or I am learning, we are trying to teach, already the boy knows it, already the girl knows it, already the student knows it. Why we are needed, our teachers are needed is, the fire is there already, the knowledge is there in the person. It is covered by ash, so it is not coming out. So the teacher's duty was to only wipe out the ash and the real knowledge from him comes out. This is the definition. This is the teacher's role as per the Vedas are concerned. And if you see, teacher is a very common word. Teacher means, actual meaning is who teaches. Whether he knows or not, he teaches. But whereas if you come to Indian language words, we have adhyapak. Adhyayan krutva adhyapan karoti chet adhyapaka bhavati. Those who prepares and comes and then he teaches and then he transfers the knowledge is adhyapaka. Then we have acharya. I think our Manisha ji will be very happy to know what is the word meaning of acharya, Jain acharya. See, it has a very deeper meaning. Achnod shastrathan sthapayate sulabhena swayam achariti iti acharya. Acharya means a man who has sufficient knowledge and who transfers it very easily. Very easily, he should be able to transfer that whatever he knows to the students. And then swayam acharati. He himself should follow that. I am giving a lecture, you should prescribe single medicine and you should give according to simillimum. And in my practice, I practice 10 medicines put in one bottle and given. That is not achar. Swayam acharati, iti acharya. And then the last one is Guru. Guru, everybody says this, Guru Brahma, Guru, everybody says this mantra, that's okay. But the actual meaning, Guru is the man who removes andhakar, the man who removes darkness. One meaning. But the other meaning of Guru is, Guru means who is big. Who is big? Laghu is small. So Guru, when you are taking that stage of Guru, you should have better knowledge than with whom you are discussing. You should have complete knowledge, minus ahankar. And then the best quality of a Guru is when the student is in doubt, without the student asking, you should be able to remove his doubts. Or when you are lecturing, make your lecture so that there are no questions. There is a new technique, you should allow students to ask questions. Definitely, yes. New question, something not out of which is not there in the syllabus. But when you take up a topic, you make it so clear that on that topic, the students should not have any questions. If they have questions, it means you are not explaining them properly. These are the few qualities of a teacher which all of us try to absorb, all of us try to practice, implement. And today I'm seeing Dr. Chiran really like a professor, and I would like definitely him to be a professor somewhere and teach, but with these qualities. No ahankar. I belong to them, I belong to this, nothing like that. Everyone belongs to everyone. With these few words, I hand over back to the President. And thank you, President, for asking me to say a few words.
Thank you, sir. There is a saying like that: teachers are talented, enthusiastic, adaptable. They are very creative. They are very honest and efficient. They are resourceful. And so once again, I wish all the teachers as well as teachers happy day. And sir, today we came to know that there is a bad day also to say that for the homeopathic fraternity. Dr. Girish Mugi, ex-principal of Dr. A.M. Sheikh Homeopathic Medical College, Belgaum. The morning he expired today morning at 3 a.m. That was really shocking.
What is the reason? What is the reason?
Now we came to know that there is a sudden massive attack.
MI, sir, MI.
Myocardial infarction. We don't know the details. Now I request all the members who are all here to maintain a 1 minute silence for his this thing. He was a teacher, he was a principal for the long period. Just 2 months back, he has retired actually. Even though he was retired, but he has continued as a director in the same institute, and he has worked in the institute for long period, different institutes also. We pray God to give their family strength to face that. Please. Thank you very much. Now, before I hand over to Dr. Deeparaje Nimbalkar, today she is going to conduct the program. I wish all the today's speakers, Dr. Shailaja, Dr. Manisha, as well as Dr. Chiran, all the best. Please, Deeparaje, continue.
Yes, thank you, sir. Thanks a lot. I request Dr. Deepa Amar to introduce our first speaker, Dr. Shailaja Shastri. Dr. Deepa Amar, please unmute yourself and introduce our first speaker.
Thank you, Dr. Deepa. I'm Dr. Deepa Amar. I'm here to introduce my close friend, Dr. Shailaja Shastri. She studied in Government Homeopathic Medical College, Bangalore, and she is a good poet and multilinguistic also. She speaks even in Sanskrit and German languages, Marathi, other than South Indian languages. She worked as pharmacy lecturer in Bhagwan Buddha Homeopathic College, and she was working as a homeopathic consultant in Cord Road Hospital, Bangalore. she's practicing since 23 years. And Dr. Delna Madam, homeopath, and Dr. Deepak Haldipur, an ENT surgeon, are her mentors. She has treated very good, very complicated cases very easily, and they're all referred by many allopathic doctors. Thank you all. Dr. Shailaja, the dais is yours.
Shri Gurubhyo Namaha. Yes, sir.
Yes, yes. Continue.
It's my pleasure to present in front of all my beloved teachers and my gurus. So Guru Brahma, Guru Vishnu, Guru Devo, Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurubhyo Namaha. And yeah, I'm thankful to all my teachers, my seniors, my juniors, and my best friends, and my main guru, Dr. Dalna Tarapure. She is the one who made me to understand what is homeopathy. She showed me all the way. I'm really thankful to her. Thank you, ma'am. And I want to say special thanks to Dr. Amritavalli. She's the one of the doctor who made me to come into this homeopathic field, along with Dr. Arti Pai, Dr. Subhadra, Dr. Amritavalli, Dr. Jailakshmi ma'am, everyone, they made me to show the way. Dr. Amritavalli is no more. She took me to Dr. Dalna Tarapure ma'am. So she has helped me in all aspects, guided me in all aspects. I'm really thankful to her. And I'm really I don't know, all my gurus are here only. Two main gurus, Dr. B.D. Patel sir and Dr. Shripad Hegde sir. So I don't have anything to say about them. They are in every step of my life. They are there. I'm really thankful to her. Thankful to them. Thank you, sir. I'll just start the cases. So first case, sir, silolithiasis. Can you see the shade, sir?
Yeah, it is visible. Continue.
Silolithiasis. This is salivary gland stone. So it has 3 pairs of salivary glands, one parotid gland, submandibular gland, and sublingual gland. So usually it is an exocrine gland. So through the duct, salivary juice will be coming. So mainly submandibular gland only, the majority of the calculi will be present. So submandibular parotid gland only, majority of salivary gland stone will occur, mainly because of calcium concentration, large duct, and more alkaline, and it has to come against the gravity and pour the saliva in the mouth. So I had a case. So she's a 22 years old, 22-year-old girl. She came with a, 1 second, sir. Nange idu melgade kanistar. She came for silolithiasis. She had a swelling on the left lower jaw. So she had a pricking sensation, reduced saliva. She had early morning aggravations, especially after waking up, and especially after eating wild non-veg, spicy food, and during mouth ulcers also. And she's along with that, she had thirstlessness. Along with that, she had uterine problems also. So there is irregular periods was there, mood swings were there, hirsutism was there, and pimples on the face are also there. That is more on before menses, she had a mood swing very much. And after menses, she used to feel comfortable. So mainly she had a desire for rich food, chicken, junk food, all those things. She had a perspiration on the palms and soles. Thirstless was there. And she's a soft nature, cries easily. And usually she used to feel comfortable after crying. And she is very adjustable. Few selective friends she has. And hobbies, she had many hobbies like dancing, novel reading, learning foreign languages. She's a very creative in nature. So she came with the report, submandibular gland report. Actually, I lost it, all the reports. So first she came with the calculi in left submandibular lobe. So this is the third report. So I had given treatment. First, I started with the pulsatilla. So because of her mild, gentle disposition and dryness of mouth and without thirst, and she is a very mild. Actually, I wanted to give first silica, but before that, she had a dry mouth and without thirst, she was there. And she was very shy to talk in front of me also. She had accompanied with her mother, and all her mother only was narrating. So I thought first let me give with pulsatilla. So I started with pulsatilla. After that, she feels her dry mouth started reducing. So she had thirst also slightly improved. So she had saliva used to come easily. So her shyness, everything slightly better, but her pain has not reduced, and her menses also it has not reduced. Pulsatilla I gave first 200 TID for 10 days I had given. Later I had given BD, but she was slight improvement was there, but not so much. Swelling was still like that only. It was palpable and it is movable. After that, I thought, okay, it is not improving, so I just gave Merxol. So especially for while chewing, it is more painful. That's why I introduced Merxol 201 dose I gave, and followed by once again pulsatilla I gave. At that time, she had a much relief in that. So she had a very much comfortable feeling. So pain has reduced, her saliva dryness mouth was reduced, and her period started improving a lot. So it was on the timely it was coming now. So her mood swing also has reduced. She felt very comfortable. Now she started, when she has coming, she was started narrating herself very easily. Then in status quo state come, once the pulsatilla I was giving, that time there was no much change. That's why that time her sweating on the palms and soles also increased. So it is a good sign. Actually, before she had the palms and soles sweating, but after giving pulsatilla and Merxol, her sweating in the palms and sole increased, but the pain in the jaw, it has reduced. So I thought that now it has become slightly softened. So I thought that, okay, let me start with the silica. So this is the time to start. So I started with the silica. So sweating profusely and mental condition also slightly improvement was there. That shyness still were persisting, but there was a slight improvement. So it ripens the abscess and promotes suppuration, that is stinging and pricking sensation on and off. It used to come, no, it will clear that one. And she is more of her image orientation. Your doctor and what will happen? She was an engineering student, so she wanted to look smart. She is a very good looking girl. So she had a very high goals and ideas. So I thought that, okay, anyhow, silica will complement as well as follow. So I gave pulsatilla. So, I gave silica. So while silica, she had a sand-like granules in her mouth, on and off started coming out. So the size has started reducing. So starting the first one size was 16 mm, then it has come to the 13.5 mm,
So, and then on 18/6/18, it has reduced to 1.6 to 0.5 mm. So in between, what happened? She was slightly that silica I was giving 200 only weekly once I was giving, followed by placebo I was giving. So in between, there was a status quo symptoms. So I gave acid floor. So that why I have given means it made compelled to move. Whatever work she has to do with the forceful. So energetically she has to do. So with her own thing she was not doing. And this acid fluoride has a flow spelling is wrong, sorry. Her action on the teeth and the bones, especially it has acid fluor as an action, but it complements as well as antidote the silica. So I just started as an intercurrent, I gave the acid fluor. After that again that small granules started coming out. Then again silica I have started. She was feeling more and more comfortable. Then it has come to too much, only a little bit it was there. Then tuja in between I have continued as an intercurrent, and followed by silica only I just gave. I tapered the silica 200 weekly I was giving. Then I made it to 10 days once, and then I made it to 20 days once, and then I made it to monthly once. Then after 6 months once I just tapered the silica. Only I had given placebo. She's much relieved. So there is a voice of her. 1 second. No. Sorry, I'm very poor in case. This was a referred case of one of my patient. So she was a 28 years old female. So she had an arcuate uterus. So arcuate uterus is like a genetical defect. That is, uterus will be in arcuate position. That is a congenital anomaly it is. So she came with her husband. She was a second wife. She had a marriage life of 3 years. She had a menarche late at 18 years of age. Her father died in accident. I have cut it short because the case is such a long. So I had made it only a few points. I have made it. So father died in an accident and he was working in KEB. After father's death, they have moved to Jaipur. She was very attached to father and not able to get enough love from mother as well as their sisters. So she was feeling more of her father. She was remembering more of her father. She was very attached to grandmother. So whenever she moves to village, she was feeling very happy. But when her mother took her to Jaipur, she was feeling very bad. When she moves to Tamil Nadu, she used to feel very happy. So she had the fear of losing her relatives. She was very dependent on anyone. So who are close to her, she was very dependent. She had a childish nature. So after marriage, she says that life has become better, but she was crying when alone. She had, because of no child, and because of that archaea uterus, they told no, it is very difficult to get the child, and she was very much worried. She has shown to many doctors. Everyone, they were saying, okay, we cannot, we can do, but we cannot assure you all those things. And she had a pimples on the face. She cannot nowadays she was unable to stand contradiction. So there is no interest in anything. So either work, sex, or any other actions or any other work, she didn't had any interest. Work we have to do means it is like a routine. She used to do the work. So she's mainly worried of her kid only. So I have no kid, no one is there to look after future, all those things she used to feel.
So she had a dreams of peculiar dreams of bus or train chasing her. She was chasing, and she was unable to catch the train or bus. She is left alone. Everyone have gone. That much dream on and off. She used to get this dream. She was very thirstless. She had a desire for salt and sweets, aversion to soul food. She is a thin build, like a manly, not so much good looking. So she was feeling bad about that. Her menses was regular, but it was dark red with the clots she had. So this is the history of self-angiography done on 18/3/2019. So it's arcuate uterus. You can see that these are the reports. Arcuate uterus. Both fallopian tubes are patent, is there. So X-ray of HCG, arcuate tube, arcuate uterus is visible. So I had given sepia 1M. First, why means actually I wanted to give Beretta carb. Once starting, I thought, oh, Beretta carb 200 I given, no change at all. 1 week I had given, no change at all. Then I thought, okay, first I have to clear the thing, then only I can come to the main picture. So I started 200, sepia 200, weekly once I used to give. Because of psychosyphilitic and indifference to everything, contradiction, indifference to relationship, even occupation also. It's all like animal character. I don't want this, I don't want that. She wants to escape from all the things. So that's why I thought, okay, sepia, let it be, it might help. So I gave sepia 200. So after sepia, she improved a bit. So she started showing interest. So, but her mood swings were not proper. From sepia 200, even I shifted to 1M also. 1M, but 15 days once I gave. So not much change, but her mood swing, disappointment and grief, it has become still more worse. But she was doing her routine work and other thing. Then I thought, okay, then Netramure I started. That is mainly from disappointment, silent grief she was having. That is the main thing she was having. Her husband used to say everything she's silently she's grieving is there. So she had more troubles during menses. Mood swing was very much. Once she will be very happy, and another 1 hour she will be crying like anything. Husband was very much confused what to do. She's so much of change is there. After giving medicine also so much change is there. Then then I gave Netramure. After Netramure, she had a cheerful feeling, comfortable, especially after caution she was feeling comfortable. So that started creating a hope in her. So she started, okay, now doctor, I am much better. But before she had a confusion in sepia stage. She was not at all interested in that. So now after that, hope of child and hope of sexual life started increasing. So I gave 1M and 1M to 1 dose every 5th day I was giving. So she was feeling comfortable. So then status quo came. Then that time I thought that, okay, then now it is the time to introduce intercurrent medicine, syphilinum. So mainly syphilinum, it's a male-like person, self-destruction was there, avoiding growth and acceptance, blaming others, sexually perverted, all these things are there. And especially total responsibility away. She doesn't want to take any responsibilities. And especially after sunset and after pressure, she used to feel aggravation. That's why I given syphilinum. Even in infertility cases, either syphilinum or medorinum will be very helpful. Medorinum will be better after sunset, but syphilinum will be aggravation after sunset. So that's why I have given syphilinum. So after that syphilinum, again I've started giving Natramure 1M. So she was feeling slightly comfortable, but not to, she was becoming more silent and silent. Then I thought that, okay, now it is the time to start Beratacab, her main constitutional we have to introduce. So that I have given mainly physically and mentally dependency, fear of losing support, incapable of taking her responsibilities. And she used to do her own work also. She was asking anything, idmat boda, admat boda, all those things she used to ask. Anticipation was there, anxiety was there, extreme hard work she was there, but that lack of creativity and imagination was not there. And in between, I had given Puja as a intercurrent, and again I have shifted to Beratacab. So after that, she has improved a lot. So after giving syphilinum, I did the scanning. So it has become there is no sonological evidence of arcuate uterus seen. It has come, and after introducing to this one, Beratacab, she felt much better. She conceived. This is her this one. It is 25 now. She is 5 months pregnancy is there. Her husband was a lycopodium. He had a oligospermia. So even for her, whenever infertility case comes, I usually take both husband and wife, whoever's problem might be. So they should not feel uncomfortable. Both husband and wife we have to treat so that the cure will be very fast. So I take both cases. For him, I have given lycopodium. His case is different. So lycopodium, syphilinum had given, Puja had given, and sulfur also had given. So he had a diabetic also. That has also reduced everything. He felt better. Then finally we had this one. So they conceived, and they are so happy now. They are almost very happy. Usually in COVID time also, they used to come, call and come, and they used to come in a bus. They were feeling, and in the only while talking outside only, I have given the medicine also. So after that, now they are very happy. They have conceived it. So thanks to homeopathy. This is one more case. No, sir, I have a time, no, sir.
Please go fast, Dr.
Yeah.
Shailaja.
Okay.
Please.
Vocal nodule in the vocal cord, squamous metaplasia and inflammation was there. So he is a 82 years old male who is an allopathic doctor. So he came with a nodule in vocal cord. So once he had operated, and again it has started. So he came, he has referred to me. So he had a desire for snacks and potatoes. And usually, but he's quiet, he's very reserved and caring for wife was there. So this is a Google image. Actually, I've lost the reports, and that doctor is also not here in Bangalore. He's in US. So I just had the Google this one. Vocal cord in the 1/3 of keratotic lesion when the B fold was there. So with the underlying edema. So I had given his case is he's a doctor, allopathic doctor. All these problems started after just. That whole nursing, they had a well-established nursing home. Their kid, they have 3 kids and 2 daughters, one doctor and one engineer, and one son who is in US. So they told, now why you want all those things? So better you take retirement. After that, they have sold that. Forcibly, they have sold that nursing home, well-established nursing home. The doctor was just seeing the patient, and his wife, she is a very good lady, very dominated lady, very educated lady. So she was looking after everything. She's a Naxwamika patient. She's very good. So she was looking after that. And they told, why we don't need any money much more. We want rest. Let them take rest. So with the forcibly, they have sold it and they came and settled in the Bangalore. After coming to Bangalore, they have nearby their daughter's house only they were staying, but they were very bold, so they were keeping their housemates. That housemates and workers, they were cheating them. So both were getting annoyed of them, and especially this auntie was getting too much worried, and she had IHT and so many other problems. So she was bedridden. So doctor was looking after that. So while taking, he had all these trouble has started for him. So depending on all the whole totality, I had given casticum. So after casticum, he has drastically improved. So that further that vocal cord polyp was there, further keep on coming, it has reduced, and it has reduced to a small size, and in between his voice has become improved. And they have gone to US also, and there also he was much better, and again came back, and again that there also he was much better. Voice was again slightly it was coming, and again casticum I had given. One dose of tuja in between I had given. That time he was feeling better. After that, casticum only I had given. Actually, I wanted to give ammonium casticum in case if more hoarseness of voice is there, then let me give. But there is no need of that. Only casticum only he has improved. But I was giving only 10 days once casticum. With the 201 m only he has improved. Only with the casticum and 1 dose of tuja. That's all. And this is his voice record.
It's not audible.
As well as allergy in the face, that also has reduced. He had petechial hemorrhage, dryness of thing. All this has come down with the casticum only. So step by step, it has reduced. So next, deviated nasal septum. This also has been referred by allopathic doctor. He had a running nose and other thing. This I have shared with my friends. So I'll just cut it short. So he was a very shy-natured boy. So he had sneezing more than 10 to 15 days, aggravation more on the nasal discharge more on the right than the left, aggravation in the morning as well as evening, after head bath and after cold winter, he used to have that. And since 4 days, that morning and sneezing, everything as was there. And he had operations. After that also, it has deviated nasal septum operation. After that also, it was not feeling better. That's why they have come here. And whole case after taking that, so I just gave silica. So his uncle was a pharmacist. Actually, for everything he inquired it. So he was in Magdi. So he inquired, can you give me? So doctor has told you, can you give him? So everything you just take care. And while he was a 20 years boy, so still he has accompanied with the uncle's friend and everything uncle's friend was telling. And I asked, can't you say? So with the shy, he started answering all those things, always looking down and occasionally made an eye contact. And slowly he started. Then that's why I had given silica weekly once. And then penta 5 phos I have given 6x. So he was much relieved that. So in between 15% he was better. Then I had introduced sulfur 1m. followed by silica only. Then with the silica 1M, he was feeling much better. Then I have reduced the dosage. Silica 1M 5 days once, for 15 days I had made it. And when he was feeling comfortable, I told him to take 15 days once and then to monthly once. And then I have tapered the silica also. Only placebo I had given. He was much better. And after 1 month, that 70% was better. In February, he had a thick extra growth, this one, that mass has, a piece of extra growth of mass has fallen from the nose. So after that, he felt much better. So his pimples are also there, that also has started reducing. So, and even remaining part of the mass also has come down. In between, I had given acid floor with what happened, silica and acid floor will follow it and clear the thing, antidote as well as accompaniment. So it will be much over. So he is much relieved with that. So thank you, sir. Thank you. In case if I have done any wrong, excuse me. So thanks a lot.